The next factor is the next group of factors is doctor related factors during interaction with the patient. The first thing is not displaying interest. As doctors, we should be mindful of the patient fact that the patients usually travel long distance and spend a lot of time waiting to see the doctors. But doctors, in their busy schedule, sometimes fail to even display interest. They don't even smile. They don't even wish the patients back. Okay, a doctor might be highly qualified and might have good intentions of the patient at heart. He might think that, okay, I should save this patient. I should diagnose him properly. I should treat him properly. But just have merely having that good intent is not enough. We should display that intent. Without displaying that intent, how will the patient know whether we are taking care of him or not, whether we are interested in the patient as a person or not? It is not possible for the patient to understand it if we are not making active efforts in order to display that we are having interest on the patient as a whole. Okay. In a study, it has been shown that 33% of the patients of a country stated that doctors had no interest on them as persons. Even a simple smile and a few kind words could address these kind of issues and allegations. The next thing is the authoritativeness of doctors. In a doctor-patient relationship, it goes without saying that doctor is more powerful. Hence, it can be easy for the doctor to become authoritative, and this attitude is not acceptable to patients, even though they don't say it at our face. They feel really, really bad if we are authoritative. Next thing is the inability to communicate. In recent times, we could see a change in doctor-patient relationship due to change in doctors' behavior towards patients as well. It's mainly due to inability of the doctors to communicate with the patients and the attenders. This is probably most of the medical colleges do not focus on communication skills during the undergraduation. Either this could be the reason, or the doctors do not have time to communicate with the patients. Either way, be there is lack of skill or be there is lack of interest. Either way, the patient is disappointed with the apparent lack of communication, which the patient considers to be the most important part of a treatment. Okay, so when under such conditions, if a doctor is making some mistakes, if there's a scope for the patient to file a case against doctors, he is definitely going to file a case. Okay, this is because he is not having a good rapport with the patient. He did not communicate to the patients and this attenders properly, and this is going to increase the risks for malpractice suits as well. The next, the next factor is the addressing the concerns of the patients. The patients needs to believe that the doctor follows an ethical code of conduct. He needs to set aside any of his concern regarding investigations, duration of hospital stay, mode of treatment, etc. If the patient has any suspicion that this doctor is making me to do these tests unnecessarily, he is making me to stay in the hospital for a longer time to earn money, or he's prescribing this medicines and CT or MRI for the sake of commissions, and all these thoughts will reduce the confidence of patients and doctors, which is going to retard the healing process. The next doctor related factor is the pillars of positive dialogue. Like there are three pillars of positive dialogue. One is trust, next is communication, and third is personalized care. Trust and personalized care are closely interrelated to the communication skills of the doctor. It not only means the verbal communication, but also the non-verbal communication, like a proper eye contact and a gentle touch or a gentle smile. The patient must feel that the doctor is interested not only in the disease, but also interested in patient himself as a person. Doctor should try to understand the perception and needs of the patient, and he should try to give the patient the dignity and the courtesy which the patients always deserve. Okay. The next doctor-related factors is answering the question. A good doctor should not only answer the questions of the patient, but also should encourage the patients to ask more and more questions. This is because patients who are coming to us are already in a new environment, which make them feel insecure. And such a condition, if the questions of a patient are brushed aside, for example, the patient might ask a very basic question, a very silly question, a very illogical question also. But if we are not addressing it properly, if we are just brushing it aside, then the patient will feel really bad. Okay, this will have a very, very bad impact on the doctor-patient relationship. Lack of time of doctors should never be a reason for rude behavior. You might be busy, but you should not behave in a rude way. Okay, so lack of time should never be a reason for rude behavior. The next doctor-related factors is the empathetic patient care. We all should understand that whenever a patient comes to visit us, he's already in stress. He would have waiting for a long time to see us. He would have traveled so long distance and he would have taken leave from his routine work. So patient comes to us in such a condition. We should try to approach him with empathy. We should not be too keen on entering data in computer or writing the case sheet. Like a few doctors, they might not even see the patient's face. Then how will the patient believe that you have a good intent? You will cure him. So we should not keep on seeing our mobile phones or computers or writing case sheets. Okay, we should try to build some kind of rapport with the patients. Once again, we should never display irritation or annoyance on the patients. Okay, the patient is not responsible for any of the problems, be it our personal problems, be it like over, like what to say, over. There are a lot of patients standing in the queue. It might be true, you might be overburdened, but it is not the mistake of the doctor. It is not the mistake of the patients. Okay, so we should not show that irritation and annoyance on the patient. Okay, you might think that whatever factors I'm saying, you might think I'm repeating it again and again. I'm like I was discussing the same in the patient factors also. I'm discussing in the doctor's related factors also. Yes, because the topic is like that. It is like over kind of overlapping. So you might think that some points are repeated. Okay, but it needs to be addressed in all these different subdomains as well. Next thing is human rights. We should learn to respect the human rights. Okay, you could see in one of the series, like I think the name of the series is Mumbai Diaries. You could see a police commissioner and a terrorist. Both of them comes for treatment at the same time. Okay, but but the doctor will continue to treat the terrorists also. Many of them around the doctor will tell that he's a terrorist, he should not be treated. But it is none of the business of a doctor to judge whether he's a good person or not, whether he's a criminal or police, whether he's a terrorist or an army person. It is not the job of the doctor. The job of the doctor is to consider everyone who is in need as their patients and give them equal care. Okay, such kind of basic human rights should be preserved. Okay, next thing is the gender sensitivity. Consider you're a male obstetrician and a female patient is coming to you. Okay, and you want to examine the female patient. You are examining without even the curtain closed. You are examining without even having a female attendant. So how the patient will feel, how what to say, uncomfortable the patient will feel. So we should address these kind of gender sensitivity issues as well, so that the patient is comfortable and he has a good relationship with us. Next thing is breaking the bad. Due to lack of communication skills, doctors cannot properly interact with patients. It is not because they do not want to, but in many cases, it is because they do not know to how to properly interact with the patient. And in many cases, they're not even trained to break the bad news as well. All this ultimately will lead to a hampered doctor-patient relationship. Next is the next group of factors we can discuss it under the topic post interaction with the patient. First thing is the measuring the patient satisfaction. Doctors and hospitals should try to regularly measure the patient satisfaction. This will help us to identify the lacuna in healthcare being provided and facilitate working towards improving it. We should also develop good managerial skills. Okay, like though we may not receive any formal training for it, it is a much required skill for the smooth doctor-patient relationship. For example, if I'm going to a medical camp and I want to I want to screen the patients for diabetes and hypertension. If suppose the glucometer strips are over now, how will I check the blood glucose level? Okay, I might say that it is not my duty. It is the duty of the other lower staffs to arrange these things. It might be true, but ultimately the patient care is hampered. The patient who was standing in a long queue in the health camp just to check his blood sugar level was not able to get it done because there is no glucometer strip. A simple glucometer strip is missing. Okay, so if in this condition I am telling it it's not my mistake, it's the mistake of my subordinate, will it be acceptable? No. Though it might not be a mistake, it is our responsibility to make sure that things are getting done. So for that, we need to develop some kind of managerial skills and sharpen it with time so that we'll be able to become better doctors and have a better relationship with the patients. Next thing is the record keeping. We being professionals do not consider these kind of non-professional activities as priorities. Okay, one example is a proper record keeping of the patients. Fortunately or unfortunately, record keeping is a priority today. MBBS students should be taught regarding the same. Okay, it is being done in some of the premier institutes like our AIIMS Patna, in which we take MBBS students to our MRD department. All medical colleges should do the same, so that the patient, so that the MBBS students realize the importance of proper record keeping. This will definitely protect them from malpractice suits in the future. Next, doctor-related factors is upgrading the clinical skills. Medicine is ever evolving, and it is the duty of the doctor to keep himself or herself updated. He should upgrade himself continuously by attending CMEs and other academic events, and they should see the latest materials, latest news, latest webinars which are posted in platforms like this. Okay. Also, we are living in the era of internet where even a layman has access to the latest treatment guidelines for his disease. If we are not updating ourselves and the patient is not getting the highest level of care, which he is already aware of because of the availability of literature in the Google, his confidence on us will decrease, ultimately affecting our relationship with the doctors. Okay. Next thing is the relationship with the pharma companies. These days, patients feel that doctors write them unnecessary medications. As I gave example previously also, patients have a perception that doctors are doing this only for the sake of commissions. So such kind of like thoughts, such kind of image on doctors should be broken, and we should try our best to establish that we are doing things for the betterment of the patient. How can we do it? It can be comfortably done in a very easier way by explaining patients why we are doing. Explain the patients why you are taking the CT, even though it's a simple headache. Explain the patients why you are writing 10 medicines. Okay, just justify why you are doing this. Explain them why you are asking them to stay another 2 days in the ward, another 2 days in the hospital. When you explain them properly, patients will be happy, and you will have a better relationship with the patients. Okay, you could see in the second week of second wave of COVID pandemic that the cases of COVID was rising, and there was severe shortage of oxygen and many other drugs. Okay, who will be blamed? Obviously, doctors will be blamed. Okay, in a good doctor-patient relationship, you as a doctor can be good, patient can be good, but when the system is not good, again the relationship will get affected. Okay, you could see a paper in BMJ showing that violence against doctors and emerging pandemic, and similar articles, medicine or martyrdom. So all these kind of articles are coming up. We could have seen that again during the peak of second COVID wave, there was no beds, severe shortage of drugs, remdesivir, shortage of oxygen, but ultimately doctors were blamed. Doctors were even beaten up. It is not practical to expect that the patient will understand the difference between errors which are committed by the doctor versus an error that is due to failure of a system. Hence, a good system, good health system is needed to nurture the doctor-patient relationship. Next is the health system related factors. First is patient facilitation. Patient also needs to be educated to clearly understand the functioning of health systems. They need to understand the roles of various professionals who provide healthcare. Hospitals should have a patient-friendly approach. Hospitals should employ staffs who can guide the patients, answering the questions patiently, and making sure their waiting time is reduced. Even the waiting time should be a patient-friendly environment. Hospitals should think of improving the comfort of the patient. Like in our medical college, they increase the OPD time late in the evening till 7 p.m. or 8 p.m. so that the working class of people can comfortably get the treatment from a hospital, and they need not take a leave for their from their daily duties in order to avail the healthcare. Okay, and we could see the rise in teleconsultation. All these things should be done in order to make the patients feel more comfortable. Next thing is educating patients about the responsibility. It is not uncommon to encounter patients coming to us asking for a drug of their choice or asking the doctor, write and give me a CT. Okay. So without even consulting a doctor, the patient will have a prefix diagnosis like they already will have a treatment they are in mind. They'll already have some investigations in mind. Okay. And this trend of doctor shopping is also increasing day by day. The patient goes from one doctor to another. Patients tends not to disclose other forms of treatment which they are undertaking, especially if that treatment belongs to an alternative stream of medicine. Okay. It could lead to serious interactions. Like there are many drugs in alternative stream of medicines, and it might interact with the drugs which are in allopathic system, leading to liver failure, renal failure, all these things. So patients should properly give the history, and they should disclose everything towards the whenever he's interacting with the doctor. Okay, so the patient should be educated about their responsibilities as well. Okay, next health system related factors is the standard operating protocols. Doctors should be protected by a system of patient safety measures, as they would have not been at the receiving end of criticism at the failure of systems. This means that, like, if proper patient safety measures are being taken, if proper SOPs are followed by hospitals, if some mistakes happens, then doctors would not be put on blame. Okay, so this SOPs must be developed, and there should be regular audits, and each case of failures or needs or error needs to be investigated. If there is a maternal death in obstetrics ward, or if there is a death in OT, then why that death happened, that should be probed. Audit should be conducted, because whenever something like a death is happening, that too due to negligence, it is definitely not the mistake of a single person. Okay, if a surgeon is operating on the wrong side and the patient dies, it's a mistake of the doctor, it's the mistake of the OT nurse, it's the mistake of the junior doctor who is working in the ward. When all these people commits a combined mistake only, such big blunders might happen. So each case of failure should be thoroughly investigated. Okay. Next thing is patient safety. The patient goes to a hospital to get well. Okay, it is completely unacceptable if the patient's life is endangered by being admitted into the hospital. Okay, deaths due to adverse medical events and reactions due to negligence do happen at times, and one of the main reasons is prescription errors, irrational prescription of antibiotics by the doctors, or not giving treatment for adequate duration, or giving the wrong drugs. All these hampers the patient safety, and the patient who comes to us for getting proper treatment, if he is getting more worse, then it is not at all acceptable. Okay. Next thing, patient load and time availability. Okay. Main concern of doctor is the limited time available for each patient. The magnitude is much more in government hospitals like AIIMS. It becomes highly challenging to develop a personal rapport in such a short span of time. What can we do? All we can do is that we can uh, we can make use of the workforce who are working for us. For example, if a doctor need not check the BP of every patient, a doctor need not check the blood glucose of every patient. He can simply ask his nursing staff outside his room to check the BP and blood sugar before he comes to us, to check the vitals, pulse rate, all these things just before he comes to us. Okay, so that he will be able to spend more time in developing the rapport with the patient rather than manually checking the blood pressure. Okay. Next thing is the patient-centered care. The health systems needs to be patient-centered and patient-friendly. This will lead to development of confidence and trust of the patient in hospital. Appropriate steps should be taken to increase the comfort of the patients. Okay, like waiting time should be reduced to minimum. The system must be transparent, and the things should be explained to patient in detail. Also, there should be a sound complaint result system. Okay. Next thing is the health promotion and disease prevention. Consider an oncologist who's handling a lot of cancer patients daily. If the system was better, then there would be strict regulations on sales of tobacco products. Awareness campaigns should have been conducted. And when the patient is visiting any other doctor for any complaints earlier in his life, that doctor would have strongly explained the ill effects of continuing smoking, because there was some weak link in this. This oncologist is now being overburdened by lung cancer patients, and though it's because he's overburdened, he's not able to give proper care to all the hundreds of patients he's handling. Okay, so the public themselves should develop the attitude of taking care of their own health. They should not depend on the government so that they'll come and take care of them. Patients should know what is good for them, what is not good for them, and they should try to take care of their own health. Okay, so that the burden on the system is decreased, as well as the own safety of the patient is ensured. Okay. Next thing is development of a referral system. A proper referral system should be in place so that cases can be managed appropriately according to the level of disease. Okay. Next factor is the grievance redressal system. Having a grievance redressal system will prevent the unjustified blame on doctors. There should be an active system available to all patients and attendants, so as well as the employees of the hospital, which would help the hospitals understand the drawbacks and constraints. The opportunity merely to talk about and share about their bad experience a patient has will help them to calm down. Okay, like if a patient is having some issue with the doctor or with the nurse, if the patient is getting an opportunity to talk with the medical superintendent or the dean of the institute, then just mere talking with the higher authority will have a calming influence of the patient. Patient will vent out his anger, and he will be okay. Okay. If we are not having this kind of redressal systems, okay, if we are not giving them an opportunity to calm themselves down, then what is going to happen? He's going to land up in courts. He's going to file a case against us. Okay, which is not good for the patients as well as it's not good for the doctors. Okay. Next thing is legal assistance. Sorry. Next thing is legal assistance. Okay. In every hospital, there should be a mechanism for providing legal help for doctors. This will increase the confidence of doctors on the healthcare system so that they will not be too afraid in handling patients. Okay. As well as it is going to make them aware about the code of conduct in the hospital. Next thing is accreditation of hospitals. There should be a system of accreditation, and the hospital should be accredited by reputed bodies like NABH, so that this will instill more confidence on patients. Like if a hospital is NABH accredited, then the patient will obviously think that okay, this hospital provides high quality of care, high standards of care. We can approach this hospital confidently. Okay, so such kind of trust patients would have if there is proper accreditation to the hospital. Next factor is media relations. Doctors should have a good relationship with medias. Doctors should aid in dissemination of legitimate health information. Media tends to highlight the unpleasant experiences and portray doctors as sinners in certain cases. When we are in good terms with them, it will help us to overcome such kind of bad impression and spreading of wrong news. Also, we should try to highlight our success stories in media as well. We should try our best to facilitate fair and balanced reporting of health issues. Okay. Next thing is the role of medical council. Medical councils are regulatory agencies for doctors. The role of these medical councils is not only restricted to laying guidelines, but also in ensuring that all these guidelines are followed properly. In addition to the ethical guidelines, medical councils should also look after whether doctors follow code of etiquette as well. Okay. The other roles of medical council include teaching of ethics, conducting CMEs routinely, regulating relationship between pharma companies and doctors, punishment for unethical conduct, giving recognition and incentives for doctors with exemplary ethical conduct, and protecting doctors from unnecessary harassment and unjustified malpractice suits. Okay, when the medical councils function effectively, it will facilitate better practices by doctors, ultimately leading to a good doctor-patient relationship. Okay, so we saw what are the different factors, what are the things which can be done, and how it is going to improve the doctor-patient relationship. Few more things we'll discuss. First thing is therapeutic relationship. Satisfaction with the doctor-patient relationship is a crucial factor in the patient opting for a treatment from a specific practitioner. A long-term good relationship between a patient and the doctor could be developed into a personal relationship, and such a relationship is a key component of patient-centered care. It has the potential to have positive health outcome for patients as it allows a therapeutic relationship between the physician and patient. This relationship begins not during the end of first treatment session, but at the very moment a patient sees a doctor. Hence, a doctor should try to have a good rapport. He should have therapeutic listening. He should listen to the patient, like with patients, and this will help them to build a better relationship. Next thing is patient participation and decision making. Okay. I'm a doctor. I have studied MBBS. I have studied MD. You do whatever I do, whatever I'm saying. Okay. So such kind of attitude should not be there. That kind of attitude is there in doctors. But when we involve patients also, like see, Mr. These are the problems you have. This is the various treatments modalities which I have in mind. These are the advantages and disadvantages. This is the cost. This is the benefits. These are the issues. If you are discussing all this and giving the authority to take the final call to the patients themselves, that's patient-centered care, and patient will be very much happy because and he will obviously say, doctor, you do the best for me. Okay, you choose it. But we should give the options to the patients about what are the different things available, what are the various modalities available, and let the patient take the final call. Okay. When we are doing this, the trust on doctors is going to increase manifold. The patient will be compliant to whatever doctor is saying. He will adhere to the treatment as well. Okay. The next thing is patient satisfaction. There are studies showing that the patients who have good and trusting relationship with the clinics are more satisfied, and satisfied patients get better clinical results. Okay, they are more willing to follow what the doctor said, and they're motivated to take care of themselves and are more comfortable seeking help whenever problem arises. Giving patients such a level of comfort will also protect us from assaults and malpractice suits. Okay, so we should try to improve the patient satisfaction as well. Next is patient's charter. It's nothing but an official document by the government or any organization that enlists various rights and responsibilities of the patients along with the code of practice followed by medical professionals. Okay, it's also released by Government of India, and such charter should be made publicly available and accessible to everyone. Okay. Next factor is organizations to improve the doctor-patient relationship. There are several organizations trying to improve the doctor-patient relationship, and they take as much as efforts possible, okay, to make this relationship organized and harmonized. There should be an harmony between the National Medical Council, State Medical Council, medical associations like IAPSM, Indian Medical Association, and other such professional bodies. Okay. Next thing is reducing the strain. Due to variety of these reasons, which we discussed over the past 1 hour, the doctor-patient relationship is under strain, and there is a lot of scope on improving this strain, improving in order to decrease the strain. Okay, increasing specialization, over-dependence on technology, commercialization, unregulated relationship with pharma, effect of private health insurance companies, all these factors are contributing to the stress in the doctor-patient relationship, and this stress will will increase the psychological burden on patients who is already stressed by ill health. Okay, so doctors, patients, as well as the systems should harmoniously work together in order to improve the doctor-patient relationship for a healthier community and for a healthier nation. Okay, so these are my references. Main references from WHO documents. Okay, so we'll end with this. Thank you so much. Have a good day. If you have any queries, you can write to me in this email ID, and I'm actively available on YouTube and Instagram as well in the same name, Dr. Venkatesh Karthikeyan. Thank you.